It is the latest challenge to face weary Venezuelans. This country, which has the world's largest proven oil reserves, is chronically short of gasoline. In the last 2 weeks, all gas stations have been taken over by the police and National Guard. Fuel is only being distributed to those that need it for official use, mainly medical staff and the security services. In Caracas, tempers were beginning to fray over who goes first. This doctor said he'd been waiting 3 days to fill up.
I understand that security is a priority now, but if 50 security vehicles are allowed through and just 2 from the medical sector, how are we meant to look after patients?
A combination of factors has led to this. Years of under-maintenance and a series of major accidents means that Venezuela produces only a fraction of the gasoline it needs for domestic use. The country is dependent on imports, but they've been hit by US sanctions against what Washington says is the illegitimate Maduro government. Last week, the Russian oil company Rosneft, which helped Venezuela sell oil and buy gasoline, pulled out of the country under the pressure of those sanctions. The timing of the fuel shortages is troubling. Venezuela is already in deep recession. Its run-down public health system is exceptionally vulnerable to the coronavirus pandemic. The fear now is that diesel, vital for goods transport, could run out too.
The moment that happens, we will see an unimaginable situation in regards to people's tolerance of food shortages. It will just worsen the current situation of near economic paralysis.
One possible solution is that US sanctions be lifted, something the UN High Commissioner for Human Rights has called for. But the Trump administration says it will only do that if Maduro stands down and a new transition government is formed. That is a demand Maduro has refused to accept. The coming weeks are looking precarious. Stephen Gibbs, CGTN.